is to demonstrate accepted routine husbandry practices in camelids. If you cannot perform these procedures safely or humanely on your own animals, or you are concerned about performing these procedures correctly and without injury to your animals or yourself, we recommend that you consult a veterinarian for assistance. In the United States, it is unlawful to offer professional veterinary services without a license. Generally, the state's Veterinary Medical Licensing Board enforces the state's code regarding the practice of veterinary medicine. Questions about this should be directed to your own state's licensing board or your veterinarian.
We will take this time to define a few medical or technical terms that we use throughout this video. Enteral means within or by way of the mouth or gastrointestinal tract. This usually refers to enteral fluids or oral fluids. This is contrasted with parenteral, which means by some other means than via the gastrointestinal tract. This usually refers to intravenous, subcutaneous, or intramuscular routes. A bolus is a single, relatively large quantity of a substance. It usually refers to a drug or therapeutic substance, and most frequently, it refers to a substance administered orally. In veterinary medicine, it is commonly used to describe a large, rounded tablet or capsule administered orally. The paralumbar region is the area adjacent to the lumbar vertebrae. It commonly refers to the triangle of the flank and is bordered by the last rib, the lumbar vertebrae, and the flank fold. Transphonate is the transfer of beneficial microorganisms, or fauna, from one animal to another. It can also refer to the substance that contains the microorganisms being transferred. This is frequently called rumen juice. Esophageal intubation is the passage of a tube into or through the esophagus, otherwise known as stomach tubing. It is important to understand which substances can and which substances cannot be administered orally. Water and oral electrolytes can be administered to restore hydration to a dehydrated animal. Transphonate or rumen juice can be administered orally to repopulate the normal microorganisms in the first stomach compartment. Mineral oil can be administered orally. However, extreme caution must be used to avoid aspiration into the lungs. There are other oral medications that can be administered orally. However, most antibiotics should not be administered orally to camelids because they will either be broken down in the first stomach compartment or the stomach interferes with the proper absorption. Many oral antibiotics can also kill off beneficial microorganisms in the camelid stomach. Please contact your veterinarian if you are unsure of whether a substance should or should not be administered orally.
Today we're going to demonstrate how to perform esophageal intubation on camelids, both llamas and alpacas. And there's many indications for performing esophageal intubation. One of the main reasons is to provide enteral nutrition in animals that cannot eat themselves. Another indication, one that veterinarians perform probably on a more regular basis, is transphonation of the animals to reestablish normal bacterial flora in their C1 compartment. Other indications include relieving a choked animal, basically either trying to pass a bolus of food that's lodged in the esophagus down into the C1 compartment, or trying to basically lavage around that bolus to break up that bolus of food so it's not lodged in the esophagus anymore. A bolus of food is basically a round ball of food that accumulates within the esophagus that will prevent further passage of any food and saliva down the esophagus. which is commonly referred to as choke. Not as commonly in alpacas and llamas as we see in cattle and other true ruminant species, but also relieving bloat and abdominal distension that can lead to respiratory compromise is also another indication for performing esophageal intubation. So today we're going to demonstrate esophageal intubation, or in other words, passing a stomach tube on a llama or an alpaca. All right, the first thing that we're going to talk about, and the first thing that we want to consider before passing a stomach tube, is the actual tube itself. And today I've brought a selection of tubes to demonstrate for you. This is the typical tube that I use for passage on adult llamas and alpacas. The thing that I like about this is it's a rather rigid tube, and it's relatively small in diameter compared to some of the other tubes that we use on larger animal species like cattle. This tube has about a 1 centimeter diameter approximately, and it is actually a fairly rigid tube, which will aid in the passage, especially through the pharyngeal region or that upper esophagus. Whereas more flimsy tubes sometimes will get caught, and the animal will be able to deviate them to the side with their tongue, and it will prevent successful passage of the tube. Also, I'd like to comment that these are actually very typical tubes that may be used in standard veterinary practice, such as equine nasogastric tubes can very commonly be employed for these purposes. Some of these other tubes are a little bit more flimsy. Hopefully you can appreciate this on the video that it bends a little bit easier than does the first tube that I showed. However, it still has a relatively small diameter, which will help to alleviate potential problems in the esophagus, causing lacerations and other trauma to the esophagus itself. However, I would like to mention that the esophagus is relatively distensible, and you can surprisingly get a rather large tube to pass, surprisingly a rather large tube than what you may think. It will actually go and pass relatively comfortably in the esophagus of an animal. Here's a more typical size for an equine nasogastric tube. It has a little bit more rigidity because of the larger diameter, and it will actually also pass. I tend to stay away from these larger tubes unless I really need the larger diameter, because I do have a bit of a concern about causing esophageal trauma. One tube that I definitely like to stay away from is the typical tube that we use for esophageal intubation in cattle. It's a very rigid tube. It's basically the same rigidity as a typical garden hose, and it's a fairly substantial diameter tube, and I'm usually scared if I pass this on an esophagus of an animal or of a smaller ruminant-like animal that I'm going to cause some trauma, which is going to be problematic. Some other tubes that are actually very good, especially for smaller animals. This is actually a stallion urinary catheter. It usually comes with a stylet inside. It's actually a very good diameter for passage on small yearling crias because of the small diameter, and it's a fairly long tube that you can get all the way down into or through the esophagus down into the first stomach compartment of an alpaca or a llama. And just to end, I want to demonstrate or show a catheter that is maybe more typical of some of the catheters that's maybe found on a farm. This is a red rubber catheter. It is one that very commonly is used for stomach tubing a very small cria, a neonatal cria that needs to either get colostrum or milk within the first few days of life. This is a tube that has some rigidity to it, enough that you can easily pass it through the pharyngeal region into the esophagus. However, it is relatively atraumatic, that with a little bit of lube and a nice gentle passage will not cause too much trauma to the esophagus itself. after we have the tube in place, we will need to have some method of administering fluids or medication that we need to get into the stomach of this animal. And here's a selection of methods for doing that. Typically for adult animals in the clinic, I use a large, what we call mouth syringe. This is typically used for cleaning out the mouth of a large animal prior to surgery. It's just a 400 milliliter or a 400 cc syringe that basically with one passage of the syringe or one filling and expression of the syringe, we can deliver 400 milliliters of fluid. And the end is small enough that it will pass on to the end of some of those larger tubes that I had shown previously. This is a catheter tip syringe. The one that I'm demonstrating here is a 60 milliliter syringe. The tip of it is different than your typical Lorlock syringes that would go onto a hypodermic needle, but this is a large tapered end that will fit onto the end of a large catheter. And for administering small amounts of fluid, 60 cc's or less, this is actually a very useful technique. For administering large volumes of fluid, I don't like to keep filling the syringe and putting that onto the tube, because that just increases the time that this tube is actually passed through the esophagus into the stomach of this animal, which can potentially lead to complications. And so I will typically elect to use a bigger syringe. However, we realize that sometimes these larger syringes are not available, and repeated use of the small syringe in those cases is certainly legitimate. I want to also mention another method, and this may be easier to do in the field if a larger syringe is not available, but you can actually put a funnel right to the end of these tubes, and as long as the end of the funnel is held above the level essentially of the stomach of these animals, usually fluid will pass spontaneously through the tube into the stomach of the animal. One thing that we may want to consider before passing a tube on an animal is the length of tube that we need to pass to encounter the C1 compartment or that first stomach compartment. And once you become familiar and accustomed to passage of the tube, we probably do not need to go through this step every time. We can be fairly comfortable that we're actually in the right spot. But when I first started doing this and when I teach students, usually what I teach them to do is hold the tube up from the mouth, down the esophagus, and into the area where, or over top, superimposed over top of the area where that stomach compartment is. And then what we can do, once we get sort of a rough idea of how much tube can actually be passed or should be passed to adequately go into that first stomach compartment, then we can put either a piece of tape or take a Sharpie marker and make a mark on that tube, so we know when we get to that point that the end of the tube is at the level of the stomach. If we do not pass enough tube into the animal, it is potential that we actually could be about halfway down the esophagus with the tube, which, if we're delivering fluids at a relatively slow rate, this is probably not a problem. But if we start giving fluids too fast, potentially some of that fluid can reflux into the pharynx area where the animal can aspirate and cause problems. Now we're going to demonstrate passage of the stomach tube. And the first thing that we need to be aware of or be conscious of is the restraint of the animal. And oftentimes we're doing this alone or with minimal assistance, but we need to have good restraint of the head and neck area as a minimum when we're passing the stomach tube. I typically stand to the left of the animal, and I use my right hand and my right arm to restrain the neck and head. Typically, I use my dominant hand, my right hand, to actually wrap around the neck, and my hand I place just over the bottom jaw of this animal. To actually get the mouth to open, I will usually put my thumb in the interdental space, so that space between the front teeth and the molars, to get the animal to open its mouth. And then what I'm going to demonstrate is a mouth speculum that we'll use to actually put in the mouth and hold the mouth open while we have the tube in place, so the animal doesn't inadvertently puncture the tube, or even worse, sever the tube and swallow the part that's actually down in the stomach. If a mouth speculum like this is not available, there's actually other forms of mouth speculums that are also appropriate. One cheap method and one easily acquired device is actually a roll of tape, and it needs to be a fairly hard, a fairly substantial roll. Ideally, just a little bit of the tape has been removed so that it's not this large. For a large mouthed animal, so an adult llama or even a large alpaca, this is probably, the animal's mouth is probably large enough to accommodate this, but if you take about half of that tape off, it will fit into a smaller animal fairly comfortably. But this will provide enough protection if we can open the mouth and get this to go into the mouth of the animal, that we can then pass our tube through this, and the roll of tape will prevent the animal from causing trauma to the tube. But before actual tube passage, what I always like to do is lubricate the tube first. And I typically use just a normal lubrication that we will use commonly for other procedures in veterinary practice. And I'll just put a small film of lube on the tube itself, so that it aids in passage down the esophagus and decreases the incidence of esophageal trauma. So we're going to open the mouth of the animal. We're going to place our mouth speculum. And then we're going to place the tube through the opening of the mouth speculum until we encounter the pharyngeal area. It's not uncommon to encounter just a little bit of resistance at the pharynx. You want to just be nice and gentle, and just use gentle passage of the tube and actually allow the animal to swallow the tube themselves and not risk getting or causing trauma to the pharynx. And what this alpaca is actually doing is, with the repeated tongue movements that maybe you can appreciate, is actually causing that tube to deviate to the side. And he's actually inhibiting or prohibiting that tube from passing. As soon as it does pass the pharynx area, it usually goes without too much resistance down the esophagus. If you have an animal that is not shaved, or that is shaved, usually you can appreciate the passage of the tube down the esophagus. And if we zoom right in here on the neck of the animal, hopefully you can see that tube, and you can appreciate that little bulge that is created as the tube transverses the esophagus. Once we're into the C1 compartment, we need to verify that we're actually in the proper place. And the way that I like to do this is I take the end of the tube and I actually blow on the end of the tube while an assistant listens over the left abdomen area, over the left paralumbar fossa of the abdomen. And if we're in the right place, we should hear bubbles in the C1 compartment as we're actually blowing bubbles in the fluid of the C1 compartment. And another way to verify that you're actually in the esophagus itself is that if you see rumen contents or C1 contents actually reflux back into the tube, that is a sure sign that you're actually in the right place. When we pull the tube out, I like to kink off the tube so that if there's any contents still in the tube, and when the tube is in the esophagus, it doesn't drain out into the back of the throat and potentially could cause aspiration. After the tube is out, the mouth speculum is then removed. Another comment that I would like to make is that it's not uncommon after tubing an animal, especially if you're administering rumen juice, that they will stand for a period of 15, 20 minutes, even a half an hour sometimes, with their mouth open. And I think it's basically the taste of the rumen contents in the mouth that actually will cause them to exhibit this behavior. And it is not cause for alarm. It does not mean that we got the rumen juice or whatever we were giving in the wrong place. And this can be perfectly normal and acceptable. So once we've successfully passed the tube through the esophagus into the stomach of the animal, and we verify that it's in the esophagus and not in the trachea, and that is very important, that verification step, then we can administer the enteral fluids, transphonet, or medications that we need to, which was the indication for putting the tube in the first place. We talked about the large dose syringe that we can use for passage of fluids. And this syringe must fit well with the tube itself prior to injecting to prevent leakage of the fluids out from around the end of the tube. If that tube is not, or that syringe is not available, we also talked about the funnel technique. And again, the aperture of the funnel needs to be able to sit and seal properly in the end of the tube. It is also important when this animal has the tube in place that before fluids are poured into the funnel, that the funnel remains above the stomach of the animal to allow fluids to go into the stomach. This should be, when we start to pour, it should be a relatively easy pour in, and it should drain into the stomach relatively easily. If it looks like it's not going, there is likely a kink in the tube, or potentially the tube is actually plugged with C1 contents, or potentially the end of the funnel is not high enough to get the needed head pressure to actually deliver the fluids into the stomach. So esophageal intubation, or passing a stomach tube on an animal, is a relatively easy procedure to perform. It may not necessarily need to be performed by a veterinarian, but there are definitely some important things that we need to keep in mind, and some important technique aspects that we need to keep in mind. And if you're not comfortable with tube passage, it is definitely something that I would advise having your veterinarian at least be with you the first few times that you pass a tube, to make sure that we are paying attention to the details. Mainly, the most important thing is that we get the tube in the esophagus and not the trachea, because delivering fluids and other medications in the trachea that were originally meant to be delivered in the esophagus can be fatal to the